Okay, welcome everyone. Since our topic this week is on advanced care planning as well as end-of-life decisions, I thought it'd be very beneficial to interview someone, since they're unable to come into the classroom this fall, to interview someone who has extensive knowledge in advanced care planning and end-of-life decisions. So I would like to welcome Jane Dohrmann, who is the program director for Palliative Care Services for Iowa City Hospice. So welcome, Jane, and I know this is kind of unusual, but during these times, this is our solution. So thank you very much for taking time out of your day to be here. So can you tell me a little bit about your role at Iowa City Hospice?
Sure. Well, as you mentioned, I'm the program director for Palliative Care Services. So that encompasses two programs. One is supportive care, which is a home-based palliative care program, and the other is Honoring Your Wishes, which is a community-wide advanced care planning initiative. My primary role is supportive care at this time and administrative work, because the Honoring Your Wishes program has kind of been reshaped since we achieved many of our goals through the years that that was my primary focus.
Great. So can you just explain more a little bit about what exactly is advanced care planning?
Sure. So advanced care planning is a process. That's what I like to tell people. It's not a one-time event, but it's a series of conversations, ideally throughout life. It's an opportunity for people to reflect on what's important to them, what their values and beliefs are, and what that means in terms of their healthcare choices. So ideally, people are having conversations and creating plans and creating legal plans and communicating those plans to the right people. And then if they choose to make a legal document, that they're getting it in the right place, so that if it ever needed to be actualized, it would be available. So there's the planning process and then the plan, as I mentioned. So we actually have what we call a person-centered healthcare directive on our website, which is honoringyourwishes.org. Really encourage people to look at that. If they haven't completed an advanced directive, that's the one that makes it a lot easier, I think, for families and for healthcare providers, because not only is it a legal, durable power of attorney for healthcare or medical power of attorney, but there's also a component where people can write in their own words what's important to them. The goal is that if anyone ever needs to have that implemented, that their voice would be heard. So legally, we all have the right to make our own healthcare decisions. We should always be doing that, but in the event that we can't, or if we could not, then this is a way to help ensure that people's healthcare preferences are honored.
Okay, so you had mentioned before about honoring your wishes. Tell us a little bit more about that.
Sure. So it was started in the fall of 2010. There was a lot happening nationally related to end-of-life decisions and what that looked like. And locally, our executive director of Iowa City Hospice at that time found some research related to what was happening in La Crosse, Wisconsin. It's a program called Respecting Choices. And they were able to demonstrate through their research that they were able to they were able to ensure that people's healthcare preferences were honored, essentially. Of the people in their town in their county, over 90% of people had advanced directives in their medical charts, and over 99% of their healthcare preferences were honored. So we said, oh my gosh, what's happening there? We'd like to do that here. So a group of leaders throughout our community, city folks, healthcare providers from our local hospitals, from our long-term care settings, faith-based folks, the senior center, all of us came together and said, okay, let's work to improve our existing structure. So honoring your wishes focused on three pieces. One is promoting conversations in advanced care planning, that I just referred to. As a part of that, we created a structure where anyone can go and meet with an advanced care planning facilitator at no cost. All of those folks have been trained. I've trained just under 500 people on how to have those conversations, and their national certifications. So that's been a big focus. So for example, a person could call Iowa City Hospice and say, I want to meet with an advanced care planning facilitator. Could make that happen. That's also true at the Senior Center and the two local hospitals. With COVID-19, we are offering those conversations by phone. So the second piece, as I mentioned, is training healthcare professionals on how to have these conversations. And to recognize that it's not a one-time conversation, as I mentioned earlier, that as we age, as our health conditions change, those conversations need to change as well. And so we have offered two different certifications, one for anyone in the community, 18 and over. Someone wants to start those advanced care planning conversations, and then certifications on how to have those conversations with people who are seriously ill or closer to the end of life. So that was the second part that we really focused on. And then the third part was improving systems. So how, as healthcare providers and as a community, do we improve systems to make sure that people's healthcare preferences are honored? So one of the things we did was work with the Joint Emergency Communication Center, where our 911 calls come in. And they have a system now, they changed their record system so that if someone has an IPOST, which stands for Iowa Physician Orders for Scope of Treatment, the portable medical order. I can talk about that a little bit more later. Anyway, they have in their system who has one, if someone wants to self-register. But that's a way to give heads up to the EMS providers or first responders to look for that in the home if they were to go to the home. Another example of that was for organizations to say, you know, how many advanced directives do we have in our medical records of the people that we're serving? Audits really hadn't taken place at all, and that's a best practice standard. Mm-hmm. So we implemented that, and all these organizations throughout town said, okay, we're going to start doing this, and we're going to share our data, and we're going to put it into collective whole, which, you know, just how many people are we serving and how many people have advanced directives. So it was very simple, but we did that collectively, which was very powerful. Mm-hmm. And then they, you know, we brainstormed together, but it was up to each system to decide how to improve their numbers, and then we set a community-wide goal. So through that type of audit and a few other community-wide audits, we felt like we changed systems and improved systems so that they could integrate that into their care. So that was another goal. And then we created a lot of plain language documents as well. So when we achieved many of our goals in 2019, we had phased out from having an advisory board and task forces and educational committees, and that was my primary focus, to kind of having an oversight committee, more of a task force. And then that's when I took on my other responsibilities as the program director for supportive care.
You've been busy.
Yeah, good.
You had mentioned the iPost. So what is the difference between an iPost and, say, a living will?
There is a difference. So when we think of advanced directives, I encourage folks to think of living wills, which are different in each state. So in the state of Iowa, the legal definition talks about if someone has an incurable or irreversible condition and are actively dying, they would not want life-sustaining treatments to be continued, for example. So that's can be a legal document which they can sign. A durable power of attorney for healthcare or a medical power of attorney is asking someone is the ideal, if they would be willing to serve in this role as your legal healthcare decision maker if you couldn't communicate. So when people do that, I really encourage folks to think about who they trust, who they can talk to easily. They need to ask them if they're willing to serve in that role, have conversations, and then give them a copy of the legal document. So if they ever needed to present that, that would be there for them. So advanced directives are really planning for the future. If there were a serious event or sudden event, IPOS turns healthcare preferences into a medical order. Okay. And it is only appropriate according to Iowa law for people who are seriously ill, have chronic critical medical conditions, or are frail and elderly. So closer to the end of life. It's actually a salmon-colored form. It looks like this.
I was hoping you had that.
It is. So
colored.
You can see it online on the Iowa Department of Public Health. You can download it. Salmon is our state color, where you can, so it's easily recognizable, and we train people to look for that. So in care centers, all of our hospice patients are offered an iPost. And actually, I shared with you what the letters stand for. It's interesting because at the national level, which is POLST, we've officially gone from saying it's physician or provider orders for scope of treatment or life-sustaining treatment, depending on the state, to just saying it's portable medical orders. Mm-hmm. Meaning that this can be followed across systems. So if I were living at home and I were a hospice patient, for example, but I needed to go to the hospital, I could take this with me. And let's say I was just very ill and couldn't talk much, they would know, they would see this. I would nod my head, yes, those are still my orders. We have to start the conversation all over again. Another piece to all of that is there used to be what we just call CPR orders or DNR orders, code status orders. And that only gives a portion of understanding of what someone may or may not want. And we should never, ever assume. And that's why we have to have these conversations. And that's why this is so important, because not only does it incorporate code status if a person's heart or breathing were to stop, but what they would want in a medical crisis or as they decline. And if they improve, this can always be redone. All of these things can always be redone at any time. I get that question asked a lot. If you complete a healthcare directive, can I do it again? Absolutely. Mm-hmm. I've done a few in my life just because my values and beliefs have changed. What I think is important has changed maybe a little bit, and I want that recorded. So, but that's the difference. And our hope is that this document is a part of a process for best practices for everyone in our state who's seriously ill or frail or elderly. The other really nice piece of this is that people birthed to age 17 could also get an iPost if they're medically frail or have a serious condition. They cannot complete their power of attorney for healthcare. But this is a great way for caregivers, adult caregivers of children, parents who may have a very seriously ill child, and they want them to be at home, but they may contact first responders, for example. This medical order can be followed by them, and they are protected by state law. So it's a really nice offering.
So if an individual was living alone and they did have an iPost, where do you recommend them putting that so EMS can see it easily if they get there? I've heard put it on the fridge, just someplace where that salmon color is really gonna, stick out for EMS to see.
Correct. That's what we train ESM providers to do, is to look on the fridge.
Look on the fridge.
Mm-hmm. Mm-hmm.
Well, thank you for that. And, we've talked about, why it's important for healthcare providers. And it definitely is a very tough conversation to have when you're talking about, end-of-life decisions. But what are your recommendations for young adults, over the age of 18? When should they start thinking about having some type of advance directive?
When they turn 18.
I know. I knew what you were going to say.
For a few reasons. One, a person is a legal adult, so we have that responsibility when we turn 18 or over, and that's a part of being a mature, responsible adult. Mm-hmm. If a person can drive, the drinking age is higher, is 21, but if a person can legally drive, when they turn 18, they should have an advance directive, or riding a bicycle. We never know when a sudden event or illness might take place. The other piece of that is that we shouldn't assume about relationships. People who are legal adults have the right to choose who they would want to make decisions on their behalf. So it's not always a parent, for example. It might be an aunt, it might be a friend, it might be an uncle, The point is that people have choices, and we want people to choose who they feel comfortable choosing. So I like to think of it as insurance. So if people are driving a car, most people have car insurance. This is another type of insurance. So we hope that it won't be activated, won't be needed for a long time. We all hope to live long, happy lives and die peacefully in the night. But that won't happen to all of us. Most of us will need someone to make a decision on our behalf. So creating a healthcare directive is a way to help ensure that one's healthcare preferences are honored. There have been a lot of cases in our history, and that's why living wills became, part of federal law, because there was family conflict. And the idea was, maybe a living will would help reduce conflict and a medical power of attorney for healthcare. And I think it does if they are done well and done right, and people know about them. Part of the challenge is that people also may have completed one. It might be in a box, either in the bank, in a vault, or at a lawyer's office. And it can never...
Which isn't helpful. It should be
not ever helpful in a crisis.
Easily accessible, yeah.
And these conversations are not easy. They are much, much easier in a calm, relaxing environment and not in a crisis. Because we don't think clearly, and there's usually a lot happening. So that's also why we recommend that.
Well, thank you. And thank you so much for spending your time talking with me today. Is there any final comments that you would like to share with the students?
Thanks. I'd encourage folks to go onto our website, honornewwishes.org. Check it out. I would encourage all of you students to get a healthcare directive. Ask your parents or people that you care about if they have one. If they don't, encourage them to do so. And talk to your grandparents. They may not have one. So encourage you to reach out. And we do have a video on iPost as well. And then the national website is pulsed.org. So thanks so much for your time.
Thank you so much, Jane.
You're welcome.
Thanks again.